Is Raja Murshid, and I will be presenting to you about infant mortality in Detroit. So, what's wrong? Most developed nations have an infant mortality of 3, meaning for every 1,000 infants born, 3 of them die. In the US, we have an infant mortality rate of about 6. And in Detroit, we have an infant mortality of 14. You, as public health students and as a health professional, we see statistics all day, every day. We know what's going on, but we don't really know the social context behind it. So I took it upon myself to really go out there and find the social context behind some of these stats on infant mortality. So what I did is that I couldn't really get interviews with mothers themselves. A lot of it had to do with HIPAA, and the other reason was I had community leaders who had experience with these mothers, so I just had to do a lot of aggressive networking to get to these people, sit down with them and talk to them. I'd ask some very general questions, kind of like, why do you believe the infant mortality rate is so high through the experiences that you've seen with mothers? And if I get an answer from them, then I would follow up with the next person and say, based on what the last person said, is this factor part of the reason why infant mortality is high? And they would, most of the time they would agree, and then I said, what can we do? So direct and structural racism, that these are the underlying factors to the mothers having lack of resources in Detroit. And then he mentioned how some of the racism that the mothers face puts them through stress levels similar to those of PTSD patients. So these mothers on a daily basis are having these stress levels. And a lot of them mentioned lack of treatment and healthcare. So even if a mother was educated, even if she had resources, because she had bad experiences within the healthcare system, there was nothing that they can even do at that point. And then lack of access to basic necessities, even including a safe environment, whole foods, and so forth. You know, a lot of times I think this was a very interesting point, is that sometimes we think people are not educated or they don't know better, but that's not the case here. It's that mothers can't prioritize self-care. So even if they know that they shouldn't do this or they should probably focus more on this, they're not able to because they have to maybe run to this bus stop and then drop their children at the other bus stop, and they're having to work 2 jobs. A lot of these things make mothers not able to prioritize their prenatal checkups. Water shutoffs cause extreme distress to these mothers. A mother who has to, so here's the thing, so in Michigan, if you don't have water for about 90 days, running water, you have there's the chance that they might take your child away from you. So a lot of these mothers are running away from home to home. If they're in a certain home, they can't afford the bill because it's really expensive. They go and run to auntie's home, and then from there they can't afford the bill. Then they move to grandma's, and now you have a bunch of homes that are literally left vacant, and simply because of water shutoffs. Again, like the structural racism, I think if we were to leave this on its own discussion, it would go for hours. And then the complicated healthcare system. So a lot of these mothers, when they go to healthcare, sure they do suffer from direct racism, but at the same time, the healthcare market has become so complicated that if they had one doctor at one appointment, then they get their insurance switched, and now they have to go to a different hospital, a different doctor. This really complicates the process for a mother who's pregnant. And she mentioned how single family-led households are a big factor. A lot of these mothers are working on their own, they're taking care of their children on their own, and they don't have any really even familial support to get through their day. A lot of this also has to do with extreme poverty, and then finally instability of returning citizens. So even if some of these mothers had spouses, a lot of them were in prison. And even when they came back from prison, there was nothing to really solidify their place and sort of help them when they get back to stabilize their family. Transit system in Detroit. And another interesting point was scarcity breeds fear. So, part of the reason why these mothers don't have community support is because other mothers are having to fight for their children, and another mother has to fight for her child. So when you have that really does breed fear within the community, that everyone's kind of self-reserved and isn't really trying to help their neighbor during the time when they really need to help themselves. So a little bit on the bright side, I'm working on an intervention right now through Optimized Rain and the STEAM Challenge, which is an entrepreneurial student competition, and I'm trying to pitch a project that would pretty much try to sort of offer some remedy for these mothers. So right now I'm in my stages of conducting research, which I've shown you guys, and then hopefully sit down to create an innovative and sustainable solution, and then finally pitch and implement the intervention. So if you're interested in hopping on this project, please let me know.
And a cross-sectional study, for example.
Thank you guys for listening.
Thank you.